Got coming up next?
Next we got a healthy living tip by the Norton Healthcare.
Right.
I think it's pretty good because he touched a lot of good things. Like, I didn't know that sleeping balled up with your arm in a crook over a lot of time can result in a lot of cubital tunnel problems.
Okay, so is that a real word? Is that something?
No, he did. He said cubital tunnel, carpal tunnel, shoulder problems.
Okay.
Yes.
All right. Well, let's find out what the good doctor had to say. So here is this week's Norton's Healthcare Healthy Living Tip.
Wow, you got that out pretty
I did. Took my time.
Hello, I'm Dr. Sandra Brooks, and I'm very pleased to present to you this month's Healthy Living Tips, a collaboration between Urban Lifestylez and Norton Healthcare.
Well, welcome back to another segment of Urban Lifestylez, Norton Healthcare Healthy Living Tips. And I have the distinct pleasure to be here today with Dr. Nunnally, who is board certified in occupational and environmental medicine. Dr. Nunnally, welcome to Urban Lifestylez.
Thank you very much, Denise.
Now, I have to tell you, I have limited knowledge about your field of occupational and environmental medicine, and the little bit of what I know about it is maybe it deals with occupational work injuries.
Correct.
And the two things that come to mind for me is maybe like back injuries, and maybe when I used to work in an office, something like carpal tunnel. Would that be something like that?
Yes, ma'am. Yes, absolutely.
But would you just please explain and expound to the viewing audience exactly what your work entails with seeing these type of injuries?
Well, with seeing injuries, what we try to do is take care of the patient just like a family physician would, but also looking out for the company's interest also.
Oh, okay.
And we try to find out what caused the back injury and to help the company do something ergonomically to try to prevent these injuries from occurring again.
Oh, okay. Would you say that, like for instance, a typical job of maybe an employee who lifts a lot, would that only be the way that they would incur a back injury, or are there other ways?
No, back injuries are interesting because people think you have to lift something heavy. All it takes is just a funny twist or bend. Doesn't take much, and they can sustain a significant injury.
Okay, so I didn't know that.
With a lot of pain. I saw a person today with a severe pain from just lifting. Of course, he was lifting, he said something 200 pounds, but it's a bend and a twist a lot of times is how these things happen.
So when you mentioned that, okay, let's say I shop in Sam's, and I see some of the employees that wear these like thick belts. Now, is that belt supposed to prevent such an injury?
No, I don't believe that, and I don't think there's any studies that support that. I don't recommend the belts because what it does, a lot of people will wear them, think they can do more, and actually injure themselves worse. Now, I do use the belt occasionally for someone who's in back pain just for some support, but it does not prevent injuries.
Oh, wow. Okay. So, in regards to other type of work-related injuries, I did mention carpal tunnel. What else is common that you see a lot of work-stained injuries?
Backs are very common. We see a lot of upper extremity injuries like carpal tunnel, elbow, shoulders, a lot of shoulder injuries.
Oh, wow.
We have a lot of knee injuries, ankle injuries, because people just walking through a plant will trip, slip, and twist their ankle, twist their knee, hurt their, I see everything. I was in the emergency room for 13 years, so I see everything in this practice that I used to see in the emergency room. Yes.
So what is part of your treatment protocol with patients with these type of work-related injuries then?
For, let's say, back. Okay. What I do for back is initially I evaluate them, I determine in my mind whether they have something significant or if it's just a strain. Most of the things, 90%, 95% of the time, it's just a strain. At that point, we usually try to keep them working on light duty. I normally like to start off therapy pretty quickly and medication for muscle relaxants and anti-inflammatories. And initially for backs, any kind of injury, really, people